Okay, so we are going to go ahead and get started with our clinical practice today. So to start, I would like to introduce you to our volunteer patient. This is Isabel. Of course, because we are in a non-official setting today, we do have our therapy cat at the bedside to keep our volunteers company. So thank you both for being here. Now, of course, for the purposes of your understanding, this is merely a demonstration. I will be actually performing the examination on this patient. Keep in mind that this is a practice setting, but I do want you to implement these skills as if you would during a real clinical setting, okay? So we are going to go ahead and get started. Now, obviously, before you come into the patient's room, you want to make sure to clean your hands thoroughly. Personal preference, I like to double cleanse, so I cleanse my hands before I come into the room, and then again when I'm in the room I do like to do a second wash in front of the patient. Okay, so now for the purposes of this examination, because it is a demonstration, our patient will not be responding to me when I ask certain questions. Keep in mind that in a real clinical setting, obviously when you're speaking to your patient, they would respond to you directly. Alright, so we will be attempting to work around baby cat today, and we are going to go ahead and get started with our demonstration, so I would like you to be taking notes. You can ask a question if you have one, okay? Alright, Isabel, as stated, my name is Dr. Perez. I will be performing your breast exam as well as your abdominal examination today. The secondary part of the examination will be a vaginal exam. I will have you reposition accordingly, and then I do want to do a quick peek at your feet just to give the students a brief look at what a foot exam would look like. Okay. Alright, so I'm going to start by putting on my gloves so my hands have been sanitized. So we're going to start with donning our gloves. Make sure you guys are using proper donning and doffing protocol there, okay? So in a real clinical setting, I would like to take this time to make some small talk with my patient. Obviously, we want to keep the relationship between patient and provider professional, but I do find that in these intimate clinical settings, it is good to build a bit of a rapport. So while I'm putting my gloves on or setting up my tools, I typically ask my patient how they're feeling, how they're doing, if they have any anxieties, if there's anything they would like to discuss before we get started. So keep that in mind, okay? Okay. As with any procedure, I want you guys to keep in mind that consent is key, okay? Consent is key. So before performing any examination on your patients, you want to make sure that you are obtaining consent verbally prior to the examination, okay? So that would look like, okay, Isabel, I would like to go ahead and get started with your breast exam. Is it okay if we proceed? I will be touching your breasts underneath your gown and then moving on to your abdominal examination, at which point I will notify you, okay? Once patient verbalizes a yes, then we can go ahead and proceed. Okay. Okay, so we are going to go ahead and proceed with our breast examination, and I always start with a visual inspection. So of course, anytime you're using a direct light near the patient's face, you always want to ask them to either close their eyes or just not look directly at the light. So Isabel is going to close her eyes for us, and we're going to start with a visual inspection. So always try to keep patient privacy at the forefront. So if you do not have to have their breast fully exposed, try to keep the gown as covered as possible, just to provide a sense of privacy. Okay, so what I'm going to do is lift up the gown and look underneath. Of course, we want to make sure that we are not missing anything, so if you feel like you're not getting good visualization, you can open up the gown as necessary. Okay. Alright, Isabel, so I am going to go ahead and begin with your visual inspection. What that's going to look like is me holding a pen light and just moving around and manipulating your gown in such a way that allows me to look at your breast thoroughly so I can ensure that there is nothing externally that looks concerning, okay? Okay. So I'm going to go ahead and begin with my visual inspection and lifting up the gown here so that I can visualize the left breast. So you want to ensure that you can see the breast in its entirety. So making sure that I can see the areola as well as the nipple and all around the sides to ensure that we are not missing anything. Okay? So visualizing the external portion there. All of that does appear normal in color, shape, and texture. So what we're looking for when we're doing our visual inspection is obviously any signs of abnormal texture, any dimpling of the skin, any redness or splotchiness, blistering of the skin. All of that is very concerning, okay? So just going to look at the side and all of that does appear normal as well. Being sure to look underneath the breast for any signs of fungal infection. If I tend to find a yeast infection or any sort of fungal infection, it tends to be underneath the breast where it holds a lot of moisture. Okay. Okay, so all of that looks okay. So we are going to go ahead and turn off our pen light. And we are going to begin with our manual palpation. Okay, so I do want to demonstrate to you what that looks like. Now, when you are performing your palpations, I want you to keep your rotation in mind, okay? So use your imagination. This is a breast. Now, when you guys are performing your palpations, it's always going to be your first 2 or 3 fingers. And I like to move in a linear motion to start. So we're going to move up, gentle but firm pressure. You can go horizontally. And then lastly, we're going to move in a circular motion, specifically around the nipple area to make sure we're not missing anything there. Okay? Okay. Alright, Miss Isabel, so we are going to go ahead and get started with your physical inspection of your breast, if that's okay. Okay. Alright, so reaching in with my hand, you're going to feel me touch your skin. And I'm just going to begin with a linear motion, so feeling with my fingers. And feeling around for any abnormal nodules. Anything that could feel concerning or like it's out of place. So keep in mind, students, that you will feel some fatty deposits, and not every woman's breast tissue is the same. So do keep in mind that some people have more fibrous tissue, and that will have a different texture and sensation upon palpation. And all of those things you will be given examples of so that you can differentiate between them, okay? Just moving around in a circular motion. I'm going to feel around the areola, underneath the breast, up towards the axillary area, following the tail of Spence there on the left side. All of that feels okay. And with palpation, I am going to squeeze the nipple and look for any abnormal discharge, which I do not see. And you would perform the same examination on this side. For privacy purposes for our volunteer patient, I'm going to do that externally, just to give you a better idea. So feeling along the breast, we'll start at the top. Going to feel a linear pattern. Again, you want to apply a firm enough pressure that you are slightly denting the skin, not so firm that you're causing discomfort, okay? So we're now going to feel horizontally breast tissue. And lastly, you would perform your circular movements. Okay, and then of course, check for any of that abnormal discharge. Obviously, prior to this, we would have made sure that our patient is not lactating. Okay? Okay, so we are going to go ahead and move on to the axillary examination. So typically we would have the patient raise hands above the head in a lying position. So Isabel, I'm going to have you place your hand over your head for me. Just relax just like that. Perfect. So now we have a visualization of the axillary area. So again, we are going to perform a visual inspection with our pen light. So just having a look here, looking for again any signs of abnormal discoloration. Pay attention to the patient's natural skin color and skin texture. I like to reference the inner elbow or inside of the arm, as this is an area that doesn't reach a lot of sunlight, so that is a very natural color that should coordinate down into the axilla. Okay, so all of that does look okay, not noting any signs of fungal infection. Hair growth is normal, and I am not seeing anything externally that I would consider concerning. So moving on to our physical inspection, same with the breast exam, we are going to perform the same pattern of movements. Okay, so I'm just going to begin by touching you here and moving in a lateral motion to start. Now remember, you need to be feeling from the breastbone up into, I like to go about a third of the way into the arm to make sure that you are fully palpating the lymph nodes here, okay? So feeling around. Feeling for any abnormal nodules. Any signs of edema in those lymphs. And I'm not feeling anything abnormal here. Okay, all right, Isabel, you can go ahead and relax your arm. So that would conclude your standard breast examination if there are no abnormalities found. Okay, so we are going to go ahead and move right along into the abdominal portion of the examination. So Isabel, I will be moving down. So when exposing the abdominal cavity, please keep privacy in mind. So we only want to expose the necessary area. So I like to do right above the rib cage, make sure the breasts are no longer exposed. And then typically I would do right above the pelvic bone, which is quite a few inches lower, but because this is just a demonstration, I'm going to bring it just below the umbilicus there, okay? So again, we are starting with a visual inspection. So Isabel, I'm just going to turn my pen light back on, okay? And I'm going to start by shining my light away from me, so directly over the abdomen. And this just allows me to assess for respiration. So I'm just looking to see how well the patient's breathing. So just looking for those normal breaths that appear symmetric from both sides, making sure there's no differences bilaterally in that one side is not raising more than the other. Also looking for any signs of agonal breathing or anything that just looks abnormal with the respirations there, okay? So I also like to shine my light from the top of the abdomen down to the umbilicus, and that just allows you to see where the shadow is cast on the abdomen, which further tests for symmetry. So just having a look at the skin's texture, noting any abnormalities there, which I am not seeing on Isabel today. So looking for any signs of skin condition, even more mild, so any signs of eczema, any patches of psoriasis, any signs of abnormal erythema, that kind of thing, okay? So not seeing any of that here. Alright, Isabel, so I am going to go ahead and move into the palpation part of the examination here, okay? So you're going to feel my hands palpating around your abdomen. I like to start by feeling around the rib cage and the chest wall. So I'm going to start at the side closest to me. 2 to 3 fingers here, same motion as with the breast exam. Slightly firmer pressure in the abdomen here, okay guys? So feeling up around the rib cage, palpating along that chest wall. Make sure you feel the sternum there, breastbone. You shouldn't feel any movement upon palpation there. Down around to the left side of the rib cage. Good. I like to hold brief pressure here. And now we are going to move horizontally across the abdomen. And not applying too firm of pressure here, as we don't want to disrupt anything before we perform our auscultations. So this is more so very gentle pressure, feeling for anything just underneath the surface of the skin. So feeling for any abnormal nodules. And so far none of that is notable in our patient today. And then briefly viewing the umbilicus, looking for any signs of abnormality or deformation. I do see that our patient had or has her belly button pierced. She does have a navel piercing, so that is something that we will be having a look at in a second. So prior to proceeding with any more extensive palpations, I would like to perform my abdominal auscultations as to not disrupt anything internally that could kind of offset what you're hearing in your stethoscope. Okay? All right. All right, Miss Isabel, so I am just going to place my stethoscope on. You will feel a cold sensation touching your abdomen. Just try to relax for me. Okay, so normal breaths, no need for deep breathing just yet. Okay, so you are going to place your stethoscope down gently. I typically warn my patient that it can be a little bit cold, and we are not using the bell side just yet. Okay? All right, so beginning here, start at the first quadrant of the abdomen. Good. Okay, midline. Good. Second quadrant. Okay. Right lower quadrant. Left lower quadrant. I'm going to listen from the breastbone down to the navel. Perfect. We're going to rotate to the bell side of our stethoscope. And listening for any active bowel sounds. Good. So it appears as if our patient has eaten recently. I do hear digestive tract functioning very well. Lateral to the rib cage on the right side as well as the left. Very good. And then one more time, directly over the umbilicus. listening mainly for any obstructions here. And all of that sounds okay. Okay. All right, Isabel, your stethoscope examination was well within normal limits. So we are going to proceed with our examination. Okay. Do you have any questions so far? Okay. All right, so let's go ahead and proceed. And now that we have done our auscultations, we are going to move on to our deeper palpations. Okay, so another palpatory assessment here. I like to make sure my gloves are pretty tight on my fingers so that my sensation is not being obstructed by the gloves. These gloves are a little big for me, so obviously in your clinical practice, make sure that you're wearing gloves that fit you snugly but comfortably. Okay. Okay. All right, so we are going to begin with our second round of palpations. Same thing, testing all 4 quadrants, just going a little bit deeper, okay? So this time you're going to feel deeper pressure here, Isabel. Good. So feeling for more of those vital organs, assessing for any sign of edema or inflammation. I want to pay close attention to the umbilical and surrounding areas, checking for any signs of hernia or abnormal distension. Okay. If this were a real clinical setting, I would then lower our covering and palpate above the pubic bone as well as along the hip bones. Okay, so pelvic area, you do want to palpate here and here. Okay, as well as directly above the bladder. So just going to feel laterally along the umbilicus. Along the navel, again not feeling for any obstruction here. And then we're going to have a brief look at this piercing, looking for any signs of occlusion or infection, both of which I am not noting. It does not appear as if this is an active piercing. So as with any examination, if your patient has any visible tattoos or piercings, obviously not a part of the examination per se, but you do just want to go ahead and have a look in case the patient should need a referral to a dermatologist there. Okay. So all of that looks good. So we have completed the palpatory examination and we are going to move on into percussion. So remember, we are using both hammers with this examination, okay? I know we had some questions about that. For the abdominal examination, you are using both hammers. It's up to your level of comfortability because this is a more relaxed setting. I am comfortable setting my second hammer on top of my patient. In a real clinical setting, I might not do that, so you would just reach for your second one, okay? All right, Isabel, we are going to go ahead and move on to some abdominal percussions. Now, what that's going to consist of is me very lightly tapping your abdomen with a couple sets of hammers. Now, to give you a demonstration of what that's going to feel like, you shouldn't feel any pain. If you do feel pain, discomfort, or tenderness in either area, please let me know. Okay. All right, so we're going to start with our percussions. Now, 2 fingers, gentle but firm pressure, and you should hear that. So from here to here, there is an audible difference. Is everyone hearing that? Kind of obtuse here. significantly more hollow here because this is a bony prominence. So that is what we are listening for audibly, okay? Now, being able to differentiate between these sounds does take a little bit of clinical practice. So for the purposes of today's demonstration, I want you to just pay attention more so to the physical components of the examination. All of the other things, as far as being able to hear for the differences audibly, that will all come with practice, okay? As with anything, we are performing these examinations in all 4 quadrants, okay? So, moving on to our second hammer, we are going to percuss around the rib cage to start. So, starting at the breastbone. Good. Okay, so that will conclude our abdominal percussions, and we are going to move on to assessing symmetry. Okay, so to assess symmetry today, we are using our calipers, okay? So I am going to measure bilaterally, measuring a couple different things. I like to have my calipers adjusted fairly tightly so that I can manipulate the width with one hand. So I'm typically holding in my dominant hand. In this case, I'm right-handed. Okay? So opening with my right hand, I am going to measure from the top kind of base of the breastbone here all the way laterally down to the end of the rib cage. And I am going to keep my calipers open. That is key. If you are reclosing your calipers with measuring bilaterally, you're essentially not doing anything, okay? So we're keeping them open, and then we are going to measure the other side and seeing if there is a difference. If you notice anything visibly, then obviously you would measure more precisely, okay? So I like to use any markers that I have present. So in this case, we are going to use her gown as well as the privacy cloth here. So just measuring from the top of the side closest to me, and then measuring the other side, checking for any differences there. If you do notice any differences, then you want to make sure that you are measuring more thoroughly, okay? I also like to go ahead and measure all the way down the abdomen, so starting right underneath the breast. We are going to measure here, and then center, and then again at the pelvic bone, okay? And then same thing, we are going to measure from right at about the pelvic bone here, center, and then again on the other side, okay? Okay. So moving right along, after measuring, I like to go ahead and perform our test for abdominal reflexes, okay? So I am going to start with a couple different things. Okay, so I'm just going to keep my secondary tools nearby. Now, Isabel, I'm going to go ahead and measure your abdominal reflexes. So what that's going to consist of is me touching your abdomen with a couple of different tools. Now, for the purposes of this examination in particular, you do not have to indicate whether or not you feel it. I'm checking for a neurological response in your, essentially in the muscles of your abdomen. Okay? So you just try to relax for me. I'm just going to touch you with a couple of different objects. And again, I'm just looking for a very natural response here. So you just relax. This first object is going to be very cold. So I like to start at the top of the first quadrant and move down towards the fourth quadrant, and we did see some notable distension there. And there. Now we are going to move horizontally across the abdomen, seeing lots of movement here, which is what we're looking for. So take note of this reaction here, okay, guys? Good. Good. So the distension or contraction of the muscles as well as the increased respiration is what we're looking for as far as a normal neurological response. So we're going to move on to testing for sharp sensation. Same thing here, Isabel. You are going to feel a very sharp, very distinct sensation. Now, this object is not going to hurt you or penetrate your skin, but it is sharp enough to where you should feel some slight discomfort. And I will give you an example of that here on your arm. So this is what you will be feeling on your abdomen. Okay? So same thing. Very good, and we are applying very gentle pressure here. Very healthy response. That contraction is what we're looking for. Good. So that is a very good response. Good. And lastly, I like to test just right underneath the rib cage there. Good. Okay. Okay. So moving on to our last test of our abdominal reflexes. This is kind of a 2-for-1 test in that I'm also testing for peripheral neuropathy. Okay. Isabel, if you feel any discomfort or any sort of burning sensation of the surface of the skin, I would like you to let me know. Okay? Now, when testing for peripheral neuropathy, I do like to do a bit of an extended test. So we are going to test every portion of the abdomen that is visible. Another thing to look for when testing for those neurological responses is a response to a change in skin texture. So aside from the kind of contractions that we see visibly, I also see that there is a dimpling or goose bumping of the skin here, which is another indication that she is reacting appropriately. Okay. always being sure to test directly over the umbilicus here. Good. Okay, so moving right along. Okay, so the last thing we're going to test as far as your abdominal examination today, Isabel, is a test for sensory perception. So what that's going to consist of is me producing certain stimuli on the skin, and I would like you to indicate, if possible, whether or not you can feel it, as well as distinguish between the different materials. So I always like to begin with our soft, and that's just kind of to introduce the patient to the tactile sensation. Now, some patients are very ticklish, so please be mindful of that. Not everyone likes being tickled. Some people find it very uncomfortable. So just try to differentiate between an unpleasant sensation and a positive response. Okay? Always, always, always give a demonstration of what you are going to do prior to asking for a response. Isabel, I'm going to be testing your sensory perception. The first tool I'm going to use is a very soft, almost cotton wisp texture. So just to give you an idea, it's going to feel something like this. Are you able to feel that? Perfect, okay. Prior to starting the examination, do make sure that your patient is actually able to feel the tactile sensation. Okay. Okay, so I'm going to begin by touching you with our soft sensation, and you just indicate to me whether or not you feel it, okay? Good. 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 Very good. Good. Mm-hmm. Okay. Okay. Perfect. Yes. Mm-hmm. Okay. And all of this should feel the same. Are there any differences in sensation as I move around the abdomen? Perfect. Okay. All right, so the next one I'm going to test is not quite sharp, but more so a pressure response. Now, the reason I like to use the acupressure tool is because it allows me to test how much of the sensation our patient needs before they feel it. So, for example, if I were to push not deeply enough to activate the spring, our patient should be able to feel that. If I'm having to press so far that the spring is activated, we might be looking at some sensory loss. Okay? Okay. All right, Isabel, so this time you're going to feel a pressure sensation, and it will feel just like this. And I'd like you to just indicate to me when you feel it. Okay? Good. Good. Very good. Perfect. And all of that should feel the same. Are there any areas that don't feel as deep of pressure? Good. So all of this feels the same. Perfect. And here feels the same. And here feels the same. Perfect. Any loss of sensation in the umbilicus? You feel this here? Perfect. Okay. Okay, so we are going to go ahead and test varying sensations. So I would like you to indicate to me whether or not you feel soft or sharp. Okay? Good. Moving right along. I'm going to go ahead and test our patient's ability to sense multiple stimuli at the same time. Okay? So Isabel, I'd like you to indicate to me whether or not you feel 1 or 2. Are you able to tell a difference there? Good. Okay. Okay, so just indicate 1 or 2. 1, good. Okay, very good. 2, very good. 1, 2, good. 2, good. 1, 1, 2, good job. 1, 2, 2, 2, 1, good job. 1, okay, very good. Always make sure that you are varying your touches. Make sure that you are not working in any sort of pattern that the patient could predict, and therefore you would get an abnormal reading or a reading that is not accurate to their sensory perception. Okay? Okay. So the very last thing we are going to test on her abdomen today is our very, very light sensation. So this is just going to be a very delicate puff of air. Okay? And I would like you to attempt to indicate to me whether or not you can feel it. If there are any portions when you cannot feel it, that's okay. The rest of your examination was normal, and this is very hard to perceive. Okay? Good. All right, so that will conclude our abdominal examination. Okay, so we are going to readjust and proceed with our gynecological exam. Okay? All right, Isabel, so that concludes the abdominal portion of our exam. So I am going to have you adjust slightly on the table. I will be placing your legs in the stirrups, and then we'll get started with our pelvic exam.